continuing medical education, today innovations in the wound care, bridging science and clinical practice by Rakesh SDM.
Adeha Dharana. So we'll go with the definition, key factors, and all these points we'll be covering next. So Vranoti Yasmat Rudayati Vranavastu Dhanashati Adeha Dharana Tasmat Pranayati Udayati. So he mentions that Vrana or this scar is the only thing that stays with us till we are dead. Yes, nothing else. So even with the present definition, it mentions that discontinuity of the epithelial surface of the skin, mucous membrane, often accompanied with the inflammation, which fails to heal, is typically associated with destruction of the underlying tissue. This is what we understand as the wound is. Okay. So let us look into the key factors that Shishudha has mentioned. He has mentioned about Chanmulo, Ashtaparigrahi, Panchalakshana and Shashti or 60 types of Chikitsa procedures, wherein he elaborately mentions what are the different causative factors. The different causative factors can occur only these 6 factors, like different doshas, Sanpatala and Agartula. Wherein we look into the different sides. See how beautifully he has mentioned any Vrana can occur only in these sides. Either it may be the skin or like Tvak Mamsa, Siras, Mayu, Sandhi, Asti and these Marmasthanas. And let us look into how rationally he has mentioned for the identification of the layer where it occurs. Right? He has mentioned the different Srava, different Gandha, different type of Vedana, Akriti, etc., which signifies or helps the physician or surgeon to identify which layer the wound is from or the Vrana is from. And an elaborate description of the Shastyopakrama helps us to manage very efficiently even in today's practice. Getting into the healing of the wound. So what is wound healing? It's a complex process, I hope all of you agree, to achieve the anatomical and functional integrity of the disrupted tissue by various components like neutrophils, macrophages, lymphocytes, collagen or the fibroblasts. So what are the phases of wound healing? So it occurs in the 4 phases, right? Immediately once there is a wound, what happens? There is hemostasis phase, wherein the bleeding is arrested, and next we go for the inflammatory phase. All the pooling of the blood takes place at that particular area of the injury, which causes edema, that is in the inflammatory phase. Next comes to the proliferative phase, where the repair of the damaged tissue happens. Next is the maturation or the remodeling phase, wherein the strengthening of the fibrosis that has happened will be more properly done. Next. So, in the present day, what are the factors that are responsible for non-healing of the ulcer? It is the same thing what Shishita has mentioned, that is, any infective conditions also patient does not show any chances of healing, or presence of any necrotic or the foreign bodies, or if there is poor blood supply or stasis or the venous engorgement or lymphatic obstruction or any of the tension to the tissues, recurrent injury to the particular tissues, or depends upon the site where the Vrana is present. If it is on a site where it is more moving, then the chances of healing is comparatively lesser. Or any of the other medicines also affect in the delayed healing of the wound. So if we look into what are the factors that contribute, okay? So there are 2 factors that contribute, that is the local factors as well as the systemic factors. The local factors include again oxygenation, absence of infection, minimal mechanical stress and optimal temperature. So all these points like good perfusion of the blood to the tissue which is injured and the maintenance of the proper temperature at the site of the wound is also explained. So if you look into the systemic features, if the patient is young, the chances of healing is quite early. If the patient is having good immune system and the hydration is good, and if the patient is having nutritious food, the concept of food or the nutrition availability is also explained for the healing of the ulcer, right? So let us try to understand what Shrishita has emphasized with the brief introduction to the ulcer and its understanding in the present day. So we have the mentioning about the Shashti-Upakrama. Here, the concept of the Vrana has been completely or detailedly explained under the three headings. The first one is management of the Vrana Shopa, that is information. Once this stage is crossed, next it forms the Vrana. So what are the different measures that can be adopted for the management of the Vrana? Next, after this, which is very much essential in the present day, that is the cosmetic purpose. Here, Sushruta also mentions the Vaikupa Chikitsa, wherein he emphasizes on proper healing of the tissue with minimal scar formation. Next. So, among the 60 Upakramas, he has mentioned the first one is the Apatarpana. Apatarpana is nothing but the Langana. So what is the benefit of Langana? Where is this used? Langana is considered as the Adhyupakrama and it is indicated in all type of the Vrana. Why this is required? Why we have to go for the Langana? If we try to understand this, Langana is wherein it helps for the stimulation of the Kayagni, in turn stimulates the Dharmagni, wherein it is required for the digestion of the ama. We all know that ama is one of the main factor, or the toxin is one of the main factor that is cause for all the disease. So first line of treatment always holds good to be the chikitsa for the ama, right? So along with this, we know that one of the main factor for ojas is the bala of the person. To conserve the ojas, Kayagni is very important. So next, coming to the different measures, like the Alepa here, he has mentioned the different procedures. Okay, out of 60, we have Alepa to Virechana. Here he emphasizes on management of the Varna Shopa before it forms, or holding it to not to convert into a Varna, to subside the disease condition of the Varna Shopa within the Shopa Avastha itself. When the decreased blood flow to an area of ulceration results in, so when there is decreased flow, it results in reduced oxygenation, nutrition and the healing rates. What can be done? So he has emphasized on application of the Alepa and the Parisheka. So what is this Alepa? Alepa is the application of different, we will not go in much detail, I will be just explaining about the rationality what Sushruta could have been mentioned. Right? So application of the Alepa with the different medicines as indicated, one thing. It is, here it is indicated in case of the inflammatory swellings, there is a Shopa which is very painful and ulcerations which are very painful. It helps in Ropana or the Shodhana of the Vrana and also heals the wound. Next, coming to the different Parishekas, that is spraying of the Kashayas. Here he has mentioned what is the cause for the pain based on whether it is the Vata dosha or the Pitta dosha or the Kapha dosha or Shodhita or the Agantuja. He has mentioned, but in case of pain caused by the vitiated Vata, he mentions about the Ushna Parisheka that is prepared out of either the ghee, oil or the meat juice, etc. But whereas in case of the Pitta, Shodhita or the Agantuja, he mentions about the Shita Parisheka. Right? But when it comes to the Kapha dosha, again he mentions about the Ushna Parisheka that is prepared out of the oil or the Gomudra, etc. Next. How does this Alepa or the Parisheka works? This helps improve the blood flow to the area. Once blood flow increases, or the fresh blood comes in, what happens? The oxygenation and the nutrient supply to that particular tissue also increases, which helps in faster healing of the tissue, as well as manages the pain and the. So here, if you look in the inflammatory stage, there is what happens. We have seen that in the stages of wound healing, there was one stage called as the second stage, that is the phase of inflammation, where in any injury there is inflammation because of the outpouring of the blood into that particular area. When there is lot of blood that perfuses to the particular area, what happens? There is congestion. Once this congestion is there, it results in the formation of shota or the edema, because of which the wound heals slowly, or it may show a tendency for non-healing as well. And this causes the department of the new or the good blood supply to the particular area. So what can be done here? In these cases, Abhyanga and Vimlapana. Abhyanga is for the whole body, Vimlapana is gentle massage over a particular lesion. So let's look into what is Abhyanga. Is, as we all know, it is indicated where we try to mobilize the doshas from complete, that's the shaka to the kosha, and remove it out. Whereas Vimlapana is a gentle massage over a lesion which is hard, which is painful. In those conditions, we can go for the Vimlapana. Thus, we understand that from the procedure of Abhyanga and the Vimlapana, there is Sroto removes the, or it helps for the Srota Avroda Nirharana. Because of which, once the Srota Avroda, the obstruction is removed, the venous return is re-established. Once the venous return is re-established, the toxins are removed and thus the deleterious effects are eliminated of the toxins which progress in the disease formation. Fine. If we have done this, but we may come across with some of the conditions wherein the Vranashofa is painful, indurated, and it is hard. We have, there is a mentioning about the procedure of fomentation or the Svedana Karma. What does this do? Svedana increases the blood flow to that particular area, thus making more neutrophils, macrophages, oxygen, nutrition, etc. available for the tissues that are fighting against these pathogen organs. So this also, this Vedana also promotes the venous return, which venous return helps in elimination of these toxins and the process of inflammation, which is very important for the tissue integrity or the healing process of the wound. Next, in case of inflammation fails to subside, even after applying these procedures, what should be done? It does not subside. So we have to go for the further stage. That is, induction of separation should be induced with appropriate drugs. So to make a Vranashofa to go for the further stage, he has mentioned about Upanaha and the Pachana. What is Upanaha? Upanaha is the hot application. So here we have made different pairs that is applied over the inflammation, which helps in the subsidence of the disease pathology and helps in case of the Amavasta Shofa, we can go for the Upanaha here. What is Pachana? He has told in case of Pachana, preparation of the Utkarika. Utkarika, that is with the different drugs like the yogurt, buttermilk, etc. It is made hot and then this hot paste is applied over the area of the inflamed area and is covered by the hair and the bandhana is done. This helps, next, this procedure of Upanaha as well as the Pachana helps in doing the dosha vilayana. So movement of the dosha takes place and thus either Vranashofa undergoes Shamana. So Vranashofa is there, we know the three avasthas of the Vranashofa. There is the Amavastha, Pachamana Avastha and the Pakva Avastha. Either it goes to Shamana or advances to the Pakva Avastha, right? So formation of the pus. So once there is a Shamana, it relieves the patient from the pain and other symptoms, right? Or when Pachana occurs, what happens? The pus that is formed localizes and it gets comes out either by itself or needs to be drained by incision, right? Next. So here we have another procedure that is mentioned wherein it is called as the Visravana or the bloodletting, where it can be done in case of the inflammation of the recent origin which have the pain. You might have come across with the different patients who have come with an acute injury and there is a hematoma, there is collection of the blood which is causing severe pain. So to relieve that, we go for the Visravana. See, in ulcerative lesions which is hard, black, congested, painful and has got the indurated margins, Krishna has advised for the Visravana here. So what happens here? Here the vitiation of the Rakta has taken place. Vitiation of Rakta has taken place because of what? Either it may be because of Vata or Pitta or the Kapha, Dushana, right? Of the Rakta has taken place. Here, depending upon the dosha that is involved, Vata, Pitta or the Kapha, respectively he has mentioned for the usage of the Shringa, Jalava or the Alaba. Next, here what happens is we know that Rakta is the Dushana is done by different dosha. Once we remove the Dushita Rakta, there is complete removal of the vitiated dosha itself. So here the Visravana helps to restrain the Pranashofa is not able to spread to the next deeper tissues or the other parts of the body. Right? Next. So we have one beautiful part in the Visravana, that is the Jalopacharana. We all know that, and many of us are practicing and getting good results out of it. That's the gyrotherapy that we have got. What is this Jalopacharana? How does it help? It acts by stimulating the microcirculation. Microcirculation stimulated, there is vasodilatation and increased vascular permeability. Right? So blood flow is increased there, fresh blood has come. This and reduces the venous congestion. Venous congestion is removed and increases the oxygen and nutrition permeation to the healing tissues. A special thing that is present in the saliva of the Jaloka has got direct impact on the wound healing, which enhances the power by angiogenesis, thereby leading to the better perfusion effect to the damaged tissues. So these are the few cases where we can see that ulcer is there, Jalopacharana is applied, and the good healing could be seen. Right? Next. Next. So in the case of venous ulcer, where we are applied Jaloka, I am sure most of you will have very good results if we are using the Jalopacharana. So here the locally vitiated dosha enter the circulation. So what happens if we do not hold or if we do not treat this locally manifested or the Pranashofa? This gets internal to the circulation. So once it gets into the circulation, the vitiated dosha and dhatu elsewhere, the similar presentation are seen. So in some patients we can see multiple shofas all over the body, right? So thus this process, to weaken this process, what should be done? So as to avoid the process of spreading of the dosha to the whole body, he has explained about the Shodhana procedure. He has mentioned particularly about the Vamana and the Virechana. Here we go for the Snehapana. So it helps in the mobilization of the doshas in the shaka and the elimination of the doshas either in the Urdhva Bhaga or the Adha Bhaga with the help of the Vamana and the Virechana. Next. So here it helps to remove the vitiated dosha from the body and also helps to desaturate the Jataradni, which is very important, and in turn facilitates the Dhatvarni as well, which promotes the healing. Thus, this detoxification of the body in turn normalizes the vitiation of the dosha and prevents the recurrence or progression of the disease or the Pranashofa. Next. So by these measures, by all these measures up to the Virechana, what happens? The Pranashofa subsides and does not get separated to cause the Prana. Able to do it. Next, if supposingly we are not able to combat the disease at this stage, once separated, what Shushruta has mentioned, he has mentioned the different procedures where we need to drain the dushin or the pus out. So, Puya Nirharana or the draining of the pus is very important procedure so that it clears off all the pathogens and the toxins from that particular area so that they don't get strengthened to attack or to involve more deeper tissues, right? So what can be done for this purpose so that it does not spread to the next? Here he has told what so that we can remove the pus or drain the pus out. He has mentioned the different measures like the Dharana, Chedana, Vedana, Lekana, Vedana, Aharana, Vedana, Visravana, and the Sivana have been mentioned. With these procedures, if the abscess is completely drained and the wound created is clean, the wound can be sutured. That is, he has explained about Sivana Karma. Once the wound is clean, there is no pathogen, there is no fault body, there is no pus, we can go for the suturing. If otherwise some remnant is there, and then we can go for the Sandhana Karma, that is the application of the medicinal labors. So here you can see that there is devitalized part of the limb, that's the toes. We had excised it. Next. Here also you can see the slough or the necrotized tissue that is also being excised. Next. Necrotized tissue of a case of bed sore for excision. Next. So here Vedana, he has told to when the collective of the pus is there, we have to drain it adequately, right? Yes, Vedana karma. Next. So in case of the Varna in the siras, that is there is bleeding, outpouring of blood. So to stop the bleeding, Sivana karma is explained. Next. So when the we try to do all these procedures, it is possible. But most of the patients that we come across tell that no, we are going to an allopathic doctor. He told that you have to go for surgery. Can you do something without surgery? Yes, it's a challenging for us. Definitely, I understand. So we need to know, or Sushruta has given emphasis on the same as well, and mentioned the other procedures. And it may also be over the marmasthanas or the patient general condition may not be fit for the surgery. Here, in these conditions, Pidana, that is application of the medicines over the shoulder, has been explained. When the medicines are made in the form of labor and applied when around the shoulder with leaving its mouth uncovered, it helps in the nirhana of the puya. What happens when here in case of labor we understand that before it dries we need to remove, but we keep it continuously so that this helps in removing or squeezing out the collected pus out from the shoulder. Next, so we have done the incision and drainage. Along with the removal of the pus, there is much challenge in here. That is, bleeding is there. So how to manage this? Sushruta has an answer for this as well here. That is, he has mentioned the Shodhastapana upayas in the form of Sandhana, Skandhana and the Pachana and the Dhanana. Next. The process of inflammation, that is the Vranashopa, ends when we drain the pus completely. But still, there may be association of the pain, bleeding, or any of the hyperemia. For these conditions, Sushruta has mentioned about the Parisheka with the Shitalatravyas, that is called as the Nirvapana. This helps in the management of the pain. Next, he has also mentioned if the ulcer shows a tendency for not healing, when the edges are dry and hard, he has mentioned about the application of the Utkarika, that is the medicinal paste that is prepared out of the different medicinal herbs and applied over the edges of the ulcer. Further, after the abscess has been drained and the pus is completely removed and the wound is created, we have a wound. Now, he has mentioned the different procedures for the Shodhana, clearing of the remnant localized toxins as well as to promote the healing, that is the Ropana. Here, for this procedure, he has mentioned about the Shodhana and the Ropana of Kashaya, Varti, Kalka, Sarpi, Taila, Rasakriya and Avachurnana prepared out of the different medicinal herbs which promotes the Shodhana and the Ropana. So here dry dressing was done in this patient. Next, Kashaya, Triphala Kashaya Parisheka was done in this condition which promoted their healing. Next is application of the Jatyagi Taila which helped in removing the necrotized tissue and faster healing of the Vrana. Here we have gone for the application of Taila in the form of creating a basti there. And this also helped in faster healing of the Varana. Next is the application of the Varti, Ksaravarti, Apamarga Ksaravarti we have applied in case of sinuses. Multiple sinuses were there and collection of pus would happen there. So we tried with the Varti which helped us achieve good results. Next is the application of the Kalka. Here we applied the Nimba Kalka which helped for the, you can see that there is a hypergranulation of the tissue which also delays or does not allow the healing process to happen. Next is the application of the Rasakriya. We have prepared the Daruharitra Rasakriya and applied that also helped in fast healing of the ulcer. And we all know that most commonly for the procedure of or the to promote a healing for the Ropana, we are using the Madhu and the Grita.
Sir,
Common. So
Vaishnavi
Madhu or the
Vaishnavina.
honey has the capability to increase
Our
the
teacher.
formation of the granulation tissue and stimulates the tissue growth and reduces the edema, the inflammation. The inhibins present in the honey is an antibacterial or the bactericidal activity, and the pH of the honey acts as the bactericidal action of the enhances the bactericidal action of the macrophages. And in the growth that we use, the saturated and the unsaturated fatty acids helps in the metabolic process to fasten the healing of the burner. Next. So, in spite of all these measures, again, if the wound still gets infected, we have done all these Kashaya, Varti, Kalka, all this, Shodhana and Ropana, but still there is infection persisting. So, he has mentioned about the Dupana. Vrana Dupana is the procedure that is mentioned with the help of different drugs like Guguru, Vacha, Sarshapa, Tingu, etc. mixed with the Grita and Dupana is done over the Vrana, which helps in combating or managing the krimi or the microorganisms and relieving the patient from the Kandu, Ruja, etc. Here the fumigation can be used for the purpose of elimination of the remnant infection from the site, and it also helps to prevent the subsequent contamination created over the healing wound. Next. So this is the Dupana that is done over the Vrana. Further onwards, here Sushruta was clear. Okay, you have got the Vrana Shofa, you managed it adequately. Sometime it progressed into Vrana, you also managed it adequately. But patient mentions about the minimal scar or the disfigurement that you could have. So he mentioned about the Vaikatapaha Chikitsa. Here, if the wound heals, but there is no proper granulation or no proper skin color achieved, then it would be a cosmetic problem. So here, either it may be decreased granulation tissue or hypergranulation tissue, for which he has mentioned about the procedures like the Utsadhana and Avasadhana, which helps in the increasing the increased or hypergranulation and removing of the hypergranulation tissue and promoting the increase or growth of the granulation tissue. Here, the wound as it heals, sometimes it may become chronic and it will show a tendency for non-healing over a period of months or years. Also, that is formation of callosity is there. So, in this condition, Sushruta mentioned about the Mrudu Karma. Here he mentions about the application of the Vatahara Dravya Lepa over the edges of the Vrana, which helps in the Mrudu Karma, and he has also advocated or the use of the Raktamokshana with the help of the Shunga. This method helps in preventing the callousness of the wound. Sometimes there may be dehiscence of the wound, that is, the wound will not heal because of the decreased or the less tensile strength wherein the granulation tissue is completely soft. So, to induce the fibrosis, he has mentioned about the Dharana Karma. Here he has mentioned the preparation with the different churna that is prepared of the Davala, Priyangu, Ashoka, Rohini, etc. and sprinkled over the Vrana. It helps to restore the normal granulation tissue and increase the tensile strength of the tissue. Next. And very importantly, we also practice this more frequently, that is the Kshara Karma. So what does this Kshara Karma does? Where it is indicated? We all know that Tatra Sharanat Kshananatva Sharaha Dushta Mamsadi Himsana Chalana. So it removes all the slough and the devitalized tissue, mobilizes it and removes out. If we go to exercise, possibly we will be exercising even the healthy granulation tissue or the bleeding may be more. But when we go for the Kshara Karma or the application of the Kshara, it beautifully does the removal of the slough. So as the wound heals, secondarily it may again get infected and the slough may be formed. So in these cases again Kshara Karma can be done. So here in these conditions where venous ulcer not showing any tendency towards healing because of the edges we trimmed the edges and the chara was applied, and we could see the faster closure of the wound here. Next. See here, we can see there is a raised surface, thickened skin, and there is no chances of healing. In this also, we applied the chart, and it showed a good tendency towards faster healing of the burn. So next, he mentions about the procedure of stopping of the bleeding. When we get into the different procedures of incision or the chara karma, again there is chances of bleeding. To stop this, or to achieve the hemostasis, Agni karma has been mentioned. Next, after the wound has healed, there may be hypopigmentation. So to get back to the normal color, again he has mentioned about the Krishna karma, which can be achieved by one of the common, that is the application of Balataka Taila. Next is he has explained about the Pandu karma. There may be hypergranulation or hyper discoloration. So to bring back to the normalcy of the skin color, he has mentioned the application of the Manjishta, Haridra, Nagaridra, etc., which helps in lightening of the skin color, getting back to the normal skin color. Next, if Pratisarana is explained, wherein with the help of the powder of Hensek, Mukta, etc., which is to be applied and rubbed over the skin, over the scar that is formed, smoother than the surrounding skin. Next, there are two factors here. There may be either decreased hair or increased hair formation along the scar. So here, decreased hair or the Roma Sanjanana has been mentioned here for the regrowth of the hair. He has mentioned about the application of the Hasidatamasi, Tarvaritra, and goat's milk. But whereas Roma Paharana, extra growth of the hair, can sometimes delay the wound healing as well as form signs or the nidus for the infection. So for this purpose, Roma Paharana has been mentioned. Next. As a person is wounded, the strength of the person definitely decreases and he loses the strength, that is called as Dhatu Kshaya, which in turn causes the Vata Prakopa, which can cause the dryness and or the dehiscence of the wound, does not show a tendency to heal. So in these conditions, he has mentioned about the Basti or the Uttara Basti, wherein the ulcers are caused predominantly by the vitiation of Vata, and those below the umbilicus are beneficial here. Next. Here this is, I would like to share a case wherein he is a young boy of maybe around 30 years, had met with an accident, RT, and he lost his limb. And he had undergone amputation twice. One is above ankle and below knee. After undergoing two surgeries, again the ulcer did not heal. Again there was a slump and pus formation. So the orthopedician suggested to go for amputation again above. And they had also the risk of life. They had told we cannot give any hope. So the patient he had come to our hospital, and we had given the Manstadi Charabasti, which promoted the faster healing along with the local management of debridement, and the wound closure was seen, and after which an artificial limb was attached, and he got married, and he is living his good family life. This is the benefit or pros of Ayurveda. Definitely we can practice if we are going for the right indication. So you can see here Vrana Basti that is applied over the venous ulcer. Next. Same here. Here the retainment of the oil particularly over the particular or over the Vrana for a particular time helps in faster healing. Next. Next, he has mentioned about the Patradana or the Bandhana, which helps to maintain. So we have seen one of the factors, that is the maintenance or regulation of the temperature, also helps in the faster healing. So for that purpose, Sushruta has mentioned about the Patradana, covering of the different leaves over the area of the Vrana, and the Bandhana, which helps in faster healing. We also know about the mentioning of bandhana with different drugs, and Sama Bandha, Gada Bandha, all these things according to different seasons as well. Right? Next. So in these cases we have gone for the venous ulcer with the Guruchi Patradana, which helped in faster healing. Next is Ashwata Patadana was also done in case of venous ulcer. Here again we had an ulcer that showed no tendency towards healing. Again we got for the Harita Pratadana. All these showed very good results of healing. Next he has mentioned about the Krimigna or the disinfection to remove the krimi from the area and promote the healing. So usage of the Ksharodaka is mentioned. We have the Kshara there, and here we have explained about the Ksharodaka, right? So these measures, basically what happens with the help of the Ksharodaka, removes the acidic media, any of the remnant slough, and prevent the growth of microorganisms, thus preventing any chance of recontamination of the wound, right? Next. So here we can see the krimi, that is maggots, that is formed in case of gangrened toe, and we could manage it with this Stanika Chikitsa itself, and promoted the healing, and the limb was saved. Next. And very important, one of the factors that we have learned, that is the nutrition or the of the deceased or the pranita. That is, Brahmana has also been emphasized, which helps in the nutrition status of the pranita. Next, he has mentioned about the Vishagna, that if any all these toxins or any of the infective conditions in turn can cause the vitiation of the whole blood. So he has mentioned the different agadas, either it may be taken in the form of internally or externally. So what we have in the present day, any infection is a giving antibiotic there, right? So in our science we have beautifully explained about the agada and the use of it, right? Here the toxins or the amavisha could contaminate and create recurrence. So chance of recurrence is there, that can be eliminated, right? Next. So the different other measures like the Shirovirachana, Nasya and Kavadagraha has all been explained in case of management of the Jatrurva, that is the oral and nasal ulcerations. Next is mentioned about the Yantra Karma, that is the use of the different instruments for the Nirharana or the removing of the slug or deep-seated foreign bodies, etc., which promotes in the healing of the ulcer. Very lastly, we comes about the mentions about the ahara, that is the wholesome food. Once the vrana or during the process of healing, as well as after the process of healing, the ahara as well as the raksha karma, that is how where a person should stay, what type of food he has to take, everything has been emphasized by Shushruta. He mentions to use of the snigdha ushna lagu ahara, which can increase on the strength of the person as well as maintain the agni, right? And the Vranita Gara continuous dupana of the Vranita Gara with the help of the Krimigna Dravyas like Gugulu, Pacha, Hingu, Sarshapa, etc. with the ghee also has been mentioned as a disinfectant, right? Next. So to conclude, I would like to tell that Shushruta has explained 60 measures of the management of the Vrana, ongoing into every detail of these different stages of wound healing, which is highly time-tested and scientific. So all these measures are practical and continue to have a great value and significance even in today's scientific and surgical era. The importance Shushruta has laid down to correct the Vrana, that is Vrana in the Amavastha or the Vrana Shopavastha and Ama Pakva and Pachamanavastha and the Vrana Avastha and Vaikratapaha, that is minimal scar formation and promoting the faster healing has been emphasized by Shushruta, which needs to be relooked in by the present day surgeons and give due credit to the principles laid down by Acharya Shushruta and Ayurveda centuries ago. Thank you.
Venous ulcer, for venous ulcer,
Yes, sir.
in Runapasti, which oil you are going to use?
Here we are using Jatyadi Taila, sir. Jatyadi Taila and Gauryaja Jatyadi Taila we had used. That has given very good results, sir.
In cheilites, what would be your treatment? Cheilites.
Keloids, actually we have tried the application, we have done for the Prachana Karma has been done and we have gone for the local application of the Apamarga Shara, but not much encouraging results could be obtained.
Rakta Mamsa Maidakshe.
In Vrinabasti,
Yes, sir.
what is the time you are going to make the oil to stay there?
Here we wait for
45
15
minutes.
minutes.
15 How many sittings usually?
Usually like for a week we did. So what the reference is taken for 1 week. Same we are done for 1 week, day, one sitting in a day. We have done, and that had really good, shown very good results.
Is there any chance of using Jatari Taila and Kasis Taila in the mixing and use it? Whether it is going to increase the proliferation of tissues very fast?
Sir, definitely, depending upon the type of the tissue involved. Like, for example, if there is more of this blood there, depending on whether the granulation tissue is less or more, we can definitely do a different combination. Definitely it will help.
So nowadays,
Yes, sir.
Madhumeha Janyama
Yes, sir.
is very common nowadays.
Yes.
So what about your opinion?
Sir, if we are able
I
to.
am asking this.
Yeah.
Madhumeha, especially in Madhumeha,
Yes.
different kind of Madhumeha are there.
Correct.
What extent and how you are going to treat the patient as early as possible?
Definitely. Sir, there are two factors. One, as we have rightly seen, that is the strength of the person and the nutritional status of the person and the comorbidities the patient has and the age of the person. All these factors help in either promoting the wound healing process or delaying the wound healing process. Once we are able to manage the diabetes in a very controlled state, then the process of healing will be very fast. And the chance of infection is comparatively more here, and the delay healing is there. So, if we can prevent that, definitely the healing process will be faster.
The Vidana Parivarjana and Aushadopachara, then
Stanic chikiৎসা. Yes, stanic chikiৎসা. Definitely.
Super.
So are you adapting maggots therapy in your setup?
Yeah, maggot therapy we have tried, sir, and that has also got fantastic results.
How to cultivate and how to preserve the
That is a
maggots?
challenging problem. So we had decayed the fish or some vegetables, etc., and grown the maggots. The problem is same like with the jalapas. Continuing or preserving them for a longer time was a little challenging. But otherwise, we could see in case of sea of breast, we saw. We applied maggots like which completely debrided the tissue so well, and the healing was very fast. If we go to debride the same tissue, the chance of bleeding is more there. But when it is done with the maggot application or the Krimi Chikitsa, it has got fantastic results.
Any Kshara Jala for the wound wash?
Yeah, we have tried that Sharadaka. In case of slough, which there is a repeated infection is there. We have done all the dressings. Again, it is again the nutritional status. We do not know why. Because ulcer was healing process maybe after a week or two. Again, it has not started to infect. Though the dressing was done properly, maintenance of cleanness, then we go for a Sharajala. So Charajala is like very beautiful, like Chara and Charajala. It deprives only the unhealthy tissues.
No, problem is, practical problem is how to prepare that Kshara Jala, because Kshara has its own pH values,
Definitely.
how much concentration to be done, whether if extra concentration be done, then what will be the fate of the wound.
Mrudu Kshara
Yes,
is
yes. Sir, we are going for the Charodaka.
Mrudu Pani Kshara.
So that will be definitely Mrudu only. That will
See,
not
that explanations are all there in the text and all those things. I am interested in practical
Practical,
things
yes, yes.
for the younger generation to understand whether we can use a pH meter to say that a pH between 4 to 7, 8 to 9, something like that, it can be used for this. If this type of things we added, definitely the things will become more convincing to the young generation.
Yes. Sir, like what we can do is, what we have experience or gone through is, once we preserve the Kshara or the Kshara Jala appropriately, it maintains its pH or the Kshara Guna.
Okay.
But if it is like over a period of time, like 6 months or a year, then the Kshara Guna is less.
Now, if your patient is there, freshly we need to prepare in my clinic.
That is difficult, sir. Like freshly preparing, because the preparation of Charadaka is a tedious process.
That's
So
the thing.
it's not like we cannot prepare it instantly. So that is one thing. But what we can do is, so one thing we mentioned about the Kshara Jala. So Tikshnata of the Kshara Jala can be seen. Once we can dip our finger, just small one drop, and put it over the tongue, we can feel that
Soreness.
or the
Tikshnata.
Tikshnata that goes so fast that shows that the chara is prepared.
Can we go for using a litmus test to
Sir,
confirm that?
That we can do like, but I'm telling the simple ways other than this. And another thing is, like for example, we have the chara jala or the chara that is prepared over a period of time. It has lost its chara property. So we are preparing a fresh chara. We can add this old one and enhance the quality of the chara there, sir.
Sir, in case of Jalukavacharana,
Yes.
are you dispose Jaluka soon after the therapy, or you have to preserve?
Yeah, like we are preserving, sir, here, and we are reusing.
Most
it
of the patients
on
are
the
not
same patient.
accept for reusing of
No,
Jaluka.
on the same patient we are doing, sir. It is not being used for the different patients. What we do is, like after the Jalokacharna is done, we make it to vomit the blood and see that it is healthy.
And you have to mention
And
the name of a
it,
patient in
name
that
of the
particular.
patient, OPD, IPD number, age, date of.
If
mention
patient
the
will
date.
not come, you are going to dispose them.
Yes, yes. Usually patient will come. We are using on the Prana and the Sandhigata Bata, etc., which are showing fantastic results. So usually patient will come for the next
Dr.
follow.
Nagaraj sir is disposing the Jaluka soon after the therapy. That's
So
why.
yeah, definitely he is in class.
So actually it's good. So he's having 1600 extra.
1600.
1680 Jalukas are there.
Yes, sir. Yes, sir.
In his
Ah,
clinic.
huge Jaloka is there in my
Yes,
clinic.
sir. Sir, I think like we can use the same Jaloka. Sometimes
The disposable
if
Jalokas.
if the like vomitus is not done adequately.
Soon after vomiting, most of the Jaloka will die.
Because of squeezing.
Excusing and all improper handling and everything.
Improper handling.
And also the Dushta Rakta will definitely affect the Jaloka.
Stagnated inside that. Even
Yes.
after proper emesis also, some blood is going to be stagnated inside that.
So what we need to say, one thing is we need to avoid squeezing, sir. In our practice, in
Just put a Haridra and ask them
what
to
we are just touching the haridra to the mouth of the Jaloka, it automatically vomits.
ejects out.
Once we squeeze, the lenticles break and it
We should not squeeze.
And that will definitely cause a death. Once. And as sir told, some remnant will be there. So what we can do is, next day, we have to clean the water. Change the water.
Even after proper emesis also, most of the Jalukas are lethargic.
We
But it
need
is
to-
not activated for next sitting.
Yes.
What I saw, what I have
Yes,
observed.
Some may.
Even after proper emesis also, for the next therapeutic procedure for the same patient, the Jaluka is not get suck more blood
More blood.
compared to previous time.
Previously, yeah. Definitely.
Means it's lethargic.
Lethargic.
Indramada Lakshanas already seen.
ಬೇರೆ ಟೆಸ್ಟ್ ಬೇಕು.
Alcohol.
So what will be the strength of a Kshara Jala if we readily prepare like 100 ml of water with 5 grams of Apamarga Kshara Jala readily mixed?
So that we may not get that results. Actually. That Chara property cannot be.
Kshara, readily Kshara available, Apamarga Kshara is available. Distilled water, you can take it and mix it.
No, that mixture would not give that result. It would be just having that concept, but that concentrated, like how we prepare a kashaya, and like or like just adding on the medicinal herbs or drugs over just warm water, or adding that before and warming the water would make a difference. No, sir. So I think better
Now,
preparation.
we need to go for an institution like SDM, this type of comparative studies. What will happen if it is prepared in a classical way, what is happening in a shortcut way, how the results will be.
Definitely.
Some of,
Will help us for the clinical practice. Definitely.
Even government
Herb
college
Bandarunas
should take
has
up
been
this
told by
studies.
Herb
Sir.
Bandarunas.
Yes, yes.
So in case of Herbanda, how to protect the Runa from the exterior contamination?
And like-
Herbanda Runa like dog bites, scorpion bite, etc. things are there. So we are not supposed to bandaging,
Yes.
even though you are going to protect the wound.
Yes, yes.
For the
like
secondary
how-
infection.
Patra lepa.
how is mentioned in case of burns. Usually we cover the whole.
ಪತ್ರ ಲೇಪ ಅವನ್ನೆಲ್ಲ ಮಾಡಿ
That we can open like even without covering is very easy. So
Covering should not be done.
covering the patient as well can be helpful, sir.
ದ ಪೀಸಿಬಲ್ ಕವರ್ ಮಾಡ್ಬೋದಾ ಸರ್ ಅಂದರೆ ಪತ್ರಲೇಪಗಳನ್ನು ಉಂಡುಗಳಲ್ಲಿ
Anything.
ಫಾರ್ ಟೈಮ್ ಬೀಯಿಂಗ್
Put anything.
1 hour ಗ್ಯಾಪ್ 1 hour
So we are covering the patient. Similar how we cover the
Over this, we are going to do the research
Yeah.
actually.
Yes, sir.
It's a
Application of Kriyakala, how we can adopt.
ಭಾಳ ದೊಡ್ಡ ಕ್ವಶನ್ ಇದೆ.
time ಆಯ್ತಪ್ಪ,
ಅದೇ. ಹೌದು, ಹೌದು.
Kriya in a Vitarikta Siddhi apina Siddhyati.
ಸಣ್ಣ ಸ್ಟಾರ್ಟ್
How
ಆಗ್ತದೆ.
we can switch over to
And he has
the.
told that Chaya approach the Dosha, Lavachena Uttarasakatisu, Detu Uttarasakatisu, Bhavati Balvantaraha. So if you are able to compact
Sir,
this
in the ground, ma'am.
any of the initial stages itself, that will be more effective or more easier to manage. That is what.
Regarding the, because you are getting the referred cases. Because if the initial cases are there, you want to refer, then how we can assess the sadhya sadhyata, it is going to pure.
ದೋಷಾಣಾನು ದೋಷಾಣಾನು ಶರೀರಕರಿದವನು
Yes, sir. Definitely.
ಯತ್ರ ಸಂಹಿತ ವೈಗುಣ್ಯ ತತ್ರ ವ್ಯಾಧ್ಯೋಪಚಾರ.
Yes, yes.
ಪ್ರಯತ್ನ ಮಾಡೋದು ಸರ್ ಅಷ್ಟೇ.
ಅಷ್ಟೇ ಅಷ್ಟೇ.
ಪ್ರಯತ್ನ ಮಾಡೋದು ಬೆಸ್ಟ್ ಪ್ರಯತ್ನ.
Possible, sir. It is possible.
ಓಕೆ ಸರ್ ಹೇಳಿ ಕನ್ಕ್ಲೂಡ್.
Thank you, sir. Thank you for the opportunity.
Thank you, Dr. Rakesh, for patiently answering all the queries.
ಇದು ಏನು ಮಾಡೋದು ಹೆಂಗೆ?
Definitely it has enhanced the knowledge of our practitioners. And now I would like to call the speakers to continue the program for the second speaker.
ಸರ್ ಬನ್ನಿ.
ಅಲ್ಲ ಇವ್ರಿಗೆ ಸನ್ಮಾನ ಆಗ್ಬಿಟ್ಟು ಅದನ್ನೇ ಹೇಳ್ತಾರೆ. ಅಲ್ಲ
Sure, want to stop.